Hi, today I'm going to talk about type 2 diabetes and its complications, in particular about macrovascular diseases. First of all, let me define diabetes. Type 2 diabetes is a chronic progressive disorder in which you get very high glucose concentration in your blood. Let me draw your attention to the prevalence of diabetes. Fundamentally, there are around 415 million people affected by diabetes, and also 1 in 11 is affected by diabetes. In terms of diabetes complications, there are macrovascular complications and microvascular complications. When you talk about macrovascular complications, stroke, heart disease and hypertension, peripheral vascular disease and food problems are the most vital. Let me elaborate on pathophysiology of diabetes. To be very precise, how you get diabetes. Now you see here, when you eat carbohydrates, you get glucose as the end result. Those glucose molecules enter to the blood vessels. In the blood, these glucose molecules will be circulating, and when you have glucose in excess, those glucose particles tend to damage the cells. Our body comprises a lot of blood vessels and cells. This is a cross section of a tissue where you have a blood vessel and some cells. So these glucose molecules, they go finding the cells. Although they want to enter to the cell, they can't enter alone. They want the support of insulin to enter to a cell. In fact, these high glucose molecules will give rise to microvascular diseases and macrovascular diseases. Today we are going to talk about macrovascular diseases and how we get macrovascular diseases. Now when you talk about macrovascular diseases, stroke, heart attacks and peripheral vascular diseases are the most commonest macrovascular diseases. And when you talk about stroke, heart diseases and peripheral vascular diseases, it's very, very interesting to know the pathophysiology behind that. To be very precise, how you get it. Let's draw a cross section of a blood vessel. And this is the lumen and this is the wall of the blood vessel. So I'm going to take a cross section. So this is the lumen, and the wall comprise 3 layers. This layer comprise endothelial cells. Here you get tunica intima and tunica media. So all these glucose molecules which are circulating in the blood, they don't expect insulin to be there in order to enter to the endothelial cells. This is something very interesting. When they enter endothelial cells, they tend to damage the endothelial cells, and you get gaps in between endothelial cells. Now the end result is all these unnecessary toxic products, unnecessary particles which are circulating in the blood, I draw it in blue. These substances, they tend to leak into the wall of the blood vessel. So these unnecessary toxic products, all these unnecessary products, they tend to damage the wall more and more. For an example, you get LDL, and these particles, you have I think by now you know what is LDL. That's a component of total cholesterol. So these LDL, in conjunction with glucose molecules and other toxic products, they make atheroma. That means a huge blood clot can be made in the intima. So these blood clots, this is a blood clot. These blood clots can circulate in the blood, and when the heart pumps out the blood, these clots can be ejected from the heart to your whole body. So these blood clots can get obstructed in the brain. So when this blood clot get obstructed in the brain vessels, the brain won't be able to get a good blood supply, and we call it as stroke. And also our heart get a good blood supply through the coronary arteries. So these coronary arteries will be blocked by these clots again. So these clots will obstruct the pathway of the coronary artery, and you will not get a good blood supply to the heart muscles. So these heart muscles tend to get damaged, and we give it a name as MI, myocardial infarction. So on top of that, these blood clots can get obstructed somewhere in the legs, and we call it as peripheral vascular diseases. So all in all, the culprit behind all these complications is the blood clot, what you made in here. So how do we prevent macrovascular diseases? Let's talk about diabetes management in brief. Diabetes management is modification of your diet, and also you have to get engaged in regular exercises, and you have to take your medication on time. Thank you.